Welcome to Living Healthy Chicago. Thanks so much for being here. Okay, let's kick things off with talking about our lungs. Have you ever found yourself tired or out of breath? Sometimes those symptoms can be serious, but you can get help. Let's meet a man who's worked with his doctor to manage his lung disease and take charge of his health. Whether it's in the office or on the golf course, Mark Cochran likes to be busy.
I live a full day. There's not a day that goes by that I don't use up the whole day.
What's the date on that? That's 11/13.
So when he started to notice some health issues a few years back, he was determined to work through them.
Fatigue and shortness of breath and a slight cough. I really thought that, this is just part of the aging process. Deal with it and just keep moving.
About a year after those symptoms started, Mark was diagnosed with pneumonia, which led doctors to take a closer look at what was going on.
I was diagnosed with IPF, idiopathic pulmonary fibrosis.
Pulmonary fibrosis means it's scarring of the lung tissue. This scarring tends to destroy the lung tissue, and that destruction actually makes it more difficult to take deep breaths in for patients. It can actually precipitate a cough, and it makes your oxygen levels go down. We don't really understand what causes IPF to occur. We're finding that people who are over the age of 60, men more than women are affected. People who are smoking are more affected. That's the unfortunate thing about idiopathic pulmonary fibrosis. It's irreversible and it tends to be progressive.
Being told that you have a terminal lung disease is scary. My obviously first concerns were my family, my business. You go through all the emotions.
The first step was starting Mark on medication.
I'm going to take a quick listen to your lungs.
Okay.
What these medications do is stop the progression or decrease the progression of the disease. So what we tell patients is that when you go on these medications, we're not making your lung function better, we just want to keep it at where it's at.
Mark's doctors also encouraged him to get moving.
I just started walking, increased the distance every day.
I think exercise is really important in this patient population. It improves quality of life, and while it doesn't actually change lung function, it actually makes people feel like they can get more air and that they can do more.
I wasn't giving up. They told me you can do as much as you want to do. And that's when the light went off in my head. Okay, well, I want to be proactive on this thing. I want to try to do the best I can.
He exercises almost every day. He eats well. He has a positive attitude about all of this. What we tell patients is that these medications and lifestyle modifications are really important for you to continue to live your life to the fullest.
For my mental well-being, knowing that I'm still capable of doing these things and being able to monitor my health has just been wonderful.
Mark's hard work has helped him keep his lung function relatively stable.
He is in control of his diagnosis rather than it controlling him. And he's been doing extremely well.
You can live with this disease. I'm functioning, I'm active, I still work a little bit, I play golf. I still do all the things I enjoy. You can live a wonderful life with this disease. I've done it. I'm going to do as much as I can as long as I can.
Mark hopes his experiences will encourage others to talk to their doctors if they notice similar symptoms.
I want people to hear my story so that when they do have that cough or they do have that fatigue, they know that, hey, you know what? Let me ask the doctor. Can we look further into this? It is a bad, ugly disease, and you don't want to sugarcoat that, but that if you do the right things, you take care of yourself, you can live with this disease.
The symptoms early on tend to be so nonspecific, and you shouldn't discount any of these symptoms. I do think that, when people start to have these symptoms, you should get checked out, because earlier diagnosis may actually stabilize the disease at an earlier point.